All right, ladies and gents, welcome back. So, since we're talking about the circulatory system, sometimes I think it's helpful for kids to understand some of the things that can occur in terms of disease processes when things don't go the way that they're supposed to. And so, we're going to take a look at just these four particular problems that are associated with the cardiovascular system. Clearly, not the end all be all list, but some of the ones that maybe are a little bit more commonly found. So, if we talk about things like heart murmurs, this has come up a couple of times as we've been talking about the way that your heart functions. Um, and a heart murmur simply is a backflow of blood, and usually it's a result of some sort of defective valve. And so, when you talk about your doctor listening to your chest, one of the things that they're listening for is, can they hear some of these abnormal sounds? They sort of sound like swooshing that you wouldn't typically hear when your valves are closed nice and tight. Um, now that whooshing or swooshing is coming from this turbulent blood that's backflowing through that valve. And heart murmurs can be congenital, meaning that they happen at birth, that there's some sort of defect in the way that that valve ended up forming. Or they can show up later in life. And if they are developed over your lifetime, usually has some sort of connection to certain conditions, things like being anemic. And so something along the lines of your body sort of pushing additional blood production because you're not able to effectively carry oxygen pushes some extra pressure on those valves and can kind of make them get stretched out, worn out. High blood pressure, similar idea, right? I'm pushing more blood pressure for other reasons. Clogged arteries, right? Too much fat in my diet, not enough exercise, that kind of stuff can increase your blood pressure, which can also have an effect on that overstretching of the valves as you get older. Overactive thyroid, similar idea. Again, that's going to increase your blood pressure, so it all gets connected back to that point. Fever, right? Okay, and just putting excess wear and tear. Again, also kind of connected to blood pressure, or at least it can be. Pregnancy, same idea. You're talking a pregnant woman doubles her volume of blood throughout her pregnancy. So once again, you're pushing up the blood pressure. And for some women, that can become a problem in terms of kind of wearing down the valve itself. Now, typically, there's no real treatment. It would have to be a really severe situation where they might talk about a valve replacement. But generally speaking, most people can kind of manage with a heart murmur that's not anything too serious. All it's going to really do is kind of slow you down, make you a little more tired, a little easier to run out of breath. And so people can kind of just mitigate the symptoms. It has to be a pretty severe case before they start talking something like surgery, although the option is there if it's necessary, but most of the time they're not really going to treat them. Something else that can come as a result of some issues where your circulatory system really isn't functioning properly with your lymphatic system. And that's this idea of edema. So as your blood is sort of moving through those capillaries, they're going to be leaking some tissue, some plasmid, some fluid. And your lymphatic system's job is supposed to be to take that fluid back up. So edema can happen when you get this extra interstitial fluid that increases, or you get some weird decrease of that from your lymphatic system back to your circulation. And you've got a whole host of risk factors that can happen with this. Heart failure can cause that, so you're not, once again, pumping enough blood, and so the fluid's kind of sitting in those capillaries for too long and leaking too much. Kidney disease can also become a problem with excess fluid. Malnutrition. Big one that happens to people that's temporary, usually, is some sort of surgery or infection. When I had my C-section with my son, all right, I had some pretty nasty edema in my legs. All the fluid buildup from leaking all that fluid as my body was trying to heal from that surgery, all pulled into my legs. And so it took about 2 weeks before my body really was able to get that fluid back out naturally. It just kind of took time, keeping my feet up, elevated, as best as I could. And inflammation in general. So could be because of an infection, could be because of hardened arteries, which kind of goes back to the potential for heart failure. And that edema can be in your pulmonary circuit, which is what's there in that top picture, or it can be part of your systemic issue, part of your systemic circuit, and then that edema can really kind of help happen usually in your limbs, and the legs are the most common. Sickle cell anemia, this is one that the AP test seems to love utilizing because it really comes back to a lot of different things. We talk about it when we talk about misfolding of proteins. We can talk about it when it comes up in terms of your heterozygous or your heterozygous advantage. So having a dominant and a recessive actually protects people in Africa from malaria. Also can come up here and just talk about the disease process itself. So what is sickle cell anemia? Well, it's abnormal hemoglobin, and it's a result of a genetic mutation that then causes a misfolding of the proteins, and so you get these weird sickled cells that aren't really capable of flowing through those really small blood vessels, those capillaries, very well. They are stiff instead of sort of stretchy and bendy like a typical red blood cell would be. They're also a little bit more sticky, and so they'll stick to each other. They'll stick to the normal red blood cells that the body is able to produce. They'll stick to the blood vessels. And the biggest problem is that they end up blocking blood flow, mostly to your limbs, mostly your organs. Your liver is a particular one that kind of can get ravaged by this one. So they'll end up causing some pain, some organ damage, especially if it's not treated. So individuals who have this disease in developed countries like here in the US, most of the treatment is just occasional blood transfusions. That seems to keep everything kind of under control. But it can cause some issues otherwise. Cardiovascular disease, this is a big one. And really, it's kind of a catch-all. It's not just a single disease itself. It's a bunch of disorders that really have anything to do with your heart and your blood vessels. And we see somewhere on the order of more than half of the deaths in the US that are being tied back to this cardiovascular disease. And there's a huge number of risks. Just having general high cholesterol, high triglyceride levels, if you smoke or you're overweight, hypertension, which is high blood pressure, stress, even oral contraceptives, so the birth control pill, does increase your risk. Not that it's going to necessarily cause you to develop cardiovascular disease, but it is something that is a potential risk factor. Diabetes, just having family history of it. We know there's increased risks, male versus female, age, race. So lots and lots go into this, and there's been some question as to whether or not calling it just general cardiovascular disease is really effective and really helpful. Maybe it should be divvied out a little bit more specifically, but at least at this point, this is what most of the medical community is kind of working under. So what kind of things can we look at in terms of assessing your risk? And one of the biggest ones is to talk about cholesterol. So we look at cholesterol panels, and remember, cholesterol is a steroid, so it's a lipid, and its job isn't necessarily something that's immediately bad for you. In fact, you need some of that cholesterol in your body because its job really is there to help maintain your membrane fluidity. So it's part of your phospholipid bilayer structure in your cell membranes. And remember, we talked about the fact that having that cholesterol there allows your cell membrane some rigidity when your body temperature is kind of going up and up and up, so that your cells don't just kind of ooze all over the place. And it works in the opposite direction as well. As your body's getting colder, at least to some level, it's going to help allow things to sort of relax and have some fluidity to it so you can continue to move things in and out of those membranes. But when we look at your cholesterol levels, really it's a question of a ratio between your LDL level, or your low lipodensity proteins, and the high density HDLs. So the HDL is the good one. This one's job is to really help remove excess cholesterol out of the body by getting it to your liver then takes care of the disposal. The LDL level, this is the one that ends up collecting, if it's too high, to the walls of your arteries. All right, your white blood cells don't really do a good job of digesting this, but they'll attempt to, and instead of actually being successful, they'll convert it into toxic form compounds. It can also cause some low-grade inflammation that's just kind of there in the background. And remember, we said inflammation is a potential risk factor to cardiovascular disease. What ends up happening to these LDLs, especially as they're sticking to the walls of your arteries, is they'll cause plaques. So sort of just build up, and that can have a whole host of issues as we start talking about blood pressure. They can break off, and we'll talk a little bit about stroke and things like that that are also connected to it. So LDL levels above 190 are considered very high, and that's not where we want them to be. But it also is an overall account of that LDL to HDL ratio. And you can decrease that ratio. Really what you're doing is pushing down the LDLs, pushing up the HDLs by exercising, not smoking, avoiding things like trans fats in your foods. And in fact, a lot of companies here in the US, we've got lots of processed foods, which can become a problem, but those trans fats are really being pulled out of a lot of the foods that we are consuming, which is good. Doesn't mean it's all gone, doesn't mean that other fats don't contribute, but trans fats tend to be one of the worst. And statin drugs are there to help reduce those LDL levels, reduce the risk of heart attacks. And a lot of them are really sort of blood thinners in terms of their overall job, or they're taking care of actually getting rid of and expelling from your body the LDLs themselves. So hypertension, right? This can also be a risk factor for cardiovascular disease, so we're talking high blood pressure. Generally, we're talking about diagnosing a patient with high blood pressure if they're consistently over 140/90 is sort of the cutoff, or at least historically that's where it's been. Now, there's been a lot of adjustments to these numbers over the years, so these numbers may be a little old, but this has sort of been close enough. And most of the time we're talking pre-hypertensive, so you're not necessarily high blood pressure consistently, but we're getting to that point where we're concerned and now we're watching you. If we talk anything from 120 to 139 over 80 to 90. All right, and so we're try to stay out of that range. Average adult, we want you to be around 120 over 70 is considered normal and healthy. So if we're above that, that's where we're being concerned. And that hypertension is going to promote this atherosclerosis, or these hardening of your arteries, which then increases the risk of heart attacks and stroke because we're not allowing enough compliance, enough give in those vessels, which drives up your blood pressure. So it's all connected to itself. And once again, lifestyle changes can help reduce the issue, dietary changes, exercise, and if need be, there are medications on the market to help reduce that blood pressure as well. So here's the atherosclerosis that I was just mentioning. So it gets created by a buildup of plaque deposits, so those sort of LDL fatty deposits in those arteries. And if you take a look, you really end up looking at stages of this atherosclerosis buildup. So if I look here, all right, here's my lining of an artery, okay? And underneath that, you're going to naturally have these foam cells, these macrophages that are just kind of hanging out, watching things, making sure that we're not having issues with other infections. And what ends up happening is somewhere along the way, you get this damage to that endothelium, which is that inner layer of tissue that lines the inside of that artery. And damage to that breakdown, injury, can end up producing what they call this sort of fat stake. And you get these extracellular matrix pulling those LDL proteins, and everything's sort of all clogging together. All right, and you get your lymphocytes in here, muscle cells are trying to get rid of this because they think it's something foreign, they think it's something bad. And so your immune system sort of ramps up some inflammatory response, infection pathway responses in an attempt to get rid of it. What ends up happening, though, is eventually that fibrous plaque, that's what we're looking at here, all right, can actually break. Okay, and when that breakage happens, now we're going to compound this problem even more. More things are going to come in. We're going to get more cholesterol that's leaking into this cap, and we continue to build up the problem, and it happens again, and we build up the problem, and it happens again, until you get this complicated lesion where that plaque breaks, exposing the connective tissue, invoking a bunch of clotting reactions, and we end up hardening this part of the artery. This is very rigid structure, and decreasing the location where your blood can actually flow through. Do that enough times, you end up clogging up and blocking up those arteries. Blood flow stops completely. And once the blood flow stops, we either need to be able to get in there with some sort of surgery, stent, which is a little metal cage. They can expand that space out and allow the blood to flow again. Plaques can break off, so there's all sorts of issues that can end up happening as a result of this. One of which can be a heart attack. If that blood clot, that blockage occurs in one of those coronary arteries that supplies the oxygen to your blood, or to your heart muscle, you can get death of that cardiac muscle. Remember that those involuntary muscles are pumping constantly contracting and relaxing, which means they need lots of oxygen because they're going through lots of cellular respiration to make lots of ATP to continue to pump. So we don't get that oxygen there fast enough, and you end up having muscle tissue that dies, and there's really no way to replace that. So when we look at trying to diagnose somebody with a heart attack or a myocardial infarction, if you want the more medicalese term, there's a lot of warning signs. So most of the common ones, we're talking about uncomfortable pressure, sort of this fullness or pain in the chest. A lot of times that pain will end up spreading into the shoulders, down your arms. You might have some lightheadedness, some fainting, some nausea. But interestingly enough, most of those warning signs that the American Heart Association and other medical groups have really pushed out there seem to be more connected to men than to women. And so, in fact, if you look at the statistics, right, we expect these symptoms in men. We expect more heart attacks in men. And so overwhelmingly, about 24% of men die each year from a heart attack, but compare that to the 42% in women. And that's because if you look at the symptoms that seem to be more connected to these heart attacks in women, things like the nausea, the weakness, just overall meh, you just don't feel well. It's a lot of stuff that we would often pass off as something else. Just some indigestion, the flu, just some hormonal PMS, whatever the case might be. And it ends up being a heart attack instead. And so the women aren't getting the care that they need fast enough. The muscle's dying, and as a result, enough of it's dying that the heart just stops beating altogether. In terms of causes, most heart attacks for men are brought on by some sort of physical exertion. They're doing some sort of physical activity that just puts them over the edge, and that blockage just can't manage to sort of function in the background. For women, on the other hand, it's emotional stress, more often than not. All right, so taking care of family, emotional job, whatever the case might be, tends to seem to be more connected to the onslaught of all of these symptoms that ultimately results in that heart attack. Stroke can also be a connection to a cardiovascular disease. So now, instead of talking about death to muscle tissue, we're talking about those blockages occurring in arteries that supply your head, supply your brain. And as a result, your brain also is a very high energy demanding organ, so lots of oxygen necessary to make that cellular respiration occur, to make that ATP function. And so the oxygen doesn't get to the brain, and we end up with neural tissue damage, neural tissue death. just like the heart attack, there are warning signs that are out there for a stroke. So things like the numbness, the weakness of your face or a limb, and particularly when it's occurring on one side of your body. Sudden confusion, trouble speaking, trouble seeing, walking, loss of balance, coordination, and it's all sudden if you look at this. All right. So when any of these symptoms come up, one of the things that most EMTs or emergency room doctors are taught is this idea of ask them to smile, all right, and you'll be able to see whether or not there is sort of droopiness to their face or numbness to their face, because they usually can only create the smile on one half as opposed to the other. Asking them to raise both arms, same idea. Can I see the difference in the weakness or numbness on one side of their body? And then asking them to talk or speak a simple sentence. And if there are misfires, neural tissue damage that's occurring, blockages that are happening, you'll be able to, through just those really three simple tasks, be able to start piecing together that a stroke may be occurring, help is needed. And sometimes they can figure out general location in your brain as to where that blockage might be occurring or that death of tissue might be happening. So if we look at the actual stages of stroke itself, you get this exotoxicity. This is the actual dying of the cells themselves, and they release this compound called glutamate, and you end up overflowing your neurons with calcium ions. And what that ends up doing is creating this what they call free radical damage, and it's due to mitochondrial disruption. So we're not getting the oxygen there, we're not breaking down and utilizing certain metabolic ions and compounds in the cells, and that mitochondria starts not being able to do its job, which is to do cellular respiration and make the ATP. And enough free radical damage occurs, then the cell will go through a process called apoptosis. It recognizes it's damaged. It recognizes that it can no longer function. There's no bringing it back per se. And so the cells will just go through programmed cell death, which in normal small amounts is a good thing. We'll replace the cell, no problem. The unfortunate part is when we're talking about stroke, there's really no way to bring back those cells because I'm not getting the oxygen there to do all of that cellular replacement. And so too many cells dying at once causes the inflammation, so your immune response comes in trying to respond to all of this tissue injury, trying to clean up all of these cells, and it just ends up really spiraling on itself. And so when they talk about diagnosing a heart attack, and stroke is the same thing, time is function. The quicker you can get it diagnosed and treated, the more function you're likely to have on the back end of the event itself.